All right, thanks, Sabrina. And we're going to keep talking about helping our children work with interfering behaviors and reducing some of the concerning behaviors that we um, are helping them with through not just interventions that want to help us reduce behaviors, but also through teaching new behaviors. I think through all of early childhood and into adolescence, a lot of what we're doing in trying to help manage behaviors is to facilitate and to teach. And so we wanted to talk about a few strategies and a few skill sets that are specific to helping to build functional communication skills, as well as to teach functional skills. And this is with a specific eye on trying to make things easier to have the needs met of a young autistic child, as well as to make sure that we're helping them learn what new skills to help express their wants and needs as effectively as possible. And these are tasks and skills that we learn from a very young age all through adulthood, because all of us can be more effective communicators and all of us still have things to learn. And so a lot of times when we have interfering behaviors, it isn't simply because someone's choosing to do poorly or being bad, it's because there are things they're not sure how to do. And if we can clear away those things and teach new skills, that can often reduce those interfering behaviors. And on to the next slide. So, like I said, we're gonna talk about a couple uh, categories of techniques that we think could be helpful for us to know a little bit about. And again, these are things that you may want to speak with some of the professionals you work with, some of whether that's at school or whether any therapy providers, things that we could be talking about and thinking about. And some of this is taken from a particular um, parent management program called RUBI, that where we teach a lot of these skills to parents and others. And one thing we want to talk about is what we call functional communication teaching. And so that's teaching a child how to effectively communicate their wants and needs in an effort to help decrease interfering behaviors when those needs aren't met. And the second thing we want to talk about a little bit is teaching skills and helping your child learn new skills to build functional independence, which in many cases, if we can pick the right skills in the right situations, can help with some of the interfering behaviors that we may be seeing. Next slide. So I'm going to turn over to Maddie here for just a couple ideas because we want to think about a little bit about the language we're using and just some clarifications also. I'll toss it over to Maddie for a moment.
Thank you, Jazz. So one of the things that you're going to hear a few times today is that the idea that behavior is communication. Uh, we autistics have a different way of communicating, a different way of trying to express our needs that sometimes come in conflict with the way the rest of the world is expecting communication. And these two different communication styles collide, we end up communicating through our behaviors that something is missing, something is wrong. And this is something that is, again, it's not a willful thing, but it's our general nature when something is not, we're not able to express things. What you see is the effect of it. So when we're going to talk today about functional communication, functional doesn't mean a judgment whether a way of communicating is good or bad, but whether the forms of communication are effective and functional in terms of getting what you're needing. So words, pictures, and gestures. And the behaviors we're talking about that we want to address are those that are interfering with the child's ability to perform the things that they want to and need to do in their life, or when it's interfering with others or property. So a lot of times we hear about problem behavior or challenging behavior, and that's usually how somebody else is feeling in interpreting this. But we really want to help the child be able to build the communication skills so that they can interact and get their needs met, and the family and is able to hear each other and understand each other. Back to you, Chess.
Excellent. Thank you, Maddie. Really great, really important thoughts and some really important context to help us think about some of these things moving forward. So let's go on to our next slide. And first, we want to talk a little more about communication. And Maddie did a really nice job highlighting how communication is a two-way street. And a lot of times, at any age, at any neurotype, when we can't communicate our wants and needs effectively, we often use other means. I remember there may have been a time in my 20s where I may have thrown a phone and I was really upset and couldn't communicate just how frustrated I was. And in a lot of those situations, if we can find a more effective way to have those needs met, we can reduce that frustration. We can reduce some of those interfering behaviors and have more effective communications and have more effective interactions as a whole. So when we're thinking about building functional communication skills, it's a lot of times helping children be more effective in the tools they use to get what they need or want in a moment. This may be if a child isn't able to say, please, mother, could I have a cookie? It may be a tap on the shoulder. It may be handing over a card or pressing a button on a communication machine. But we're wanting to identify and find ways to have those wants and needs identified and when needed met as effectively and efficiently as possible so that that other form of communication, the screaming, crying, kicking, saying bad words, those are less likely to happen. And those things are often things that are less, there are more effortful and more difficult for a child to do, but they often don't have any other strategy to get those wants and needs met. So we want to teach another form of communication, another way to express those wants and needs so that we can have better outcomes for everyone. Next slide. So again, when we're thinking of functional communications, we know definitionally that autistic individuals have differences in social communication that are often different than neurotypical peers, than neurotypical adults and other individuals. Just as everyone has difficulty and differently, everyone has their own forms of communication that need to be highlighted. And so when we're thinking of functional ways to communicate, this may be simpler words as opposed to whole sentences. It may also be pictures, other gestures, other forms of electronic communication, alternative forms of communication. And it may be a tap on the shoulder, like I said, it may be a high five, it may be a hand wave, but anything that is able to replace that behavior, that interfering behavior, to get that need met more efficiently and more effectively. And so when we're thinking of reducing interfering behaviors, we're always thinking about the function of the behavior. We talked about that a little bit at the beginner. What is the function? What is maintaining? What is that keeping that interfering behavior going? And so when we're finding a functional communication strategy, we want to think of a communication strategy that's going to serve the same function, but is going to be more appropriate and effective in that given situation. And that's an important thing to be thinking about. Next slide. So let's think real quick about an example of what this could be. This could be a situation where someone is needing, a child is cold and needing help putting their coat on. And so they are needing help putting their coat on, and they don't have any verbal words to use to help with their coat. They can't get it on. So they're getting frustrated and they start yelling and they swing their coat around and they knock over a vase, let's just say. What functional communication will be trying to teach is to be thinking, let's say that child has a communication device, and we teach them, if we see them start to struggle, to teach them to, instead of starting to yell or scream or get upset, to instead go to that communication device and press a button that says, help, help please. And when you press that button, or if you give a card that says help please, or we could teach the word, just the single word, help. And if you say the word help, you immediately get help getting the coat on. And that will bypass that instance where that difficulty of that challenge, that interfering behavior may occur. So the benefits of a situation of teaching functional communication is it often addresses the interfering behaviors proactively. So our goal is to, instead of waiting until after where we've got into this difficulty where we're swinging our coat around, we're screaming, we're upset, we're trying to instead, to before that happens, teach a new strategy so that into the future, before the outburst occurs, before the interfering behavior occurs, we can bypass that with another communication strategy. And again, this long-term can be particularly helpful because it isn't just a reactive telling a child what we don't want them to do. it's a proactive and facilitation of development where we're teaching them what to do, what's going to help, what's going to get you what you need, what is going to be a way that we can work together to move things forward. What's going to be the best way that we can help understand what the autistic child is trying to communicate in a given moment. This is also helpful because a lot of times when we can teach a proactive skill, that skill can then be used in other settings, where when we react to interfering behaviors, that often only changes that behavior in that one given setting. And we know autistic children sometimes have difficulties generalizing new skills from one setting to another. And so when we teach some of these skills, we can help teach them in multiple different settings, which is ultimately going to create more functional independence and more opportunities for effective communications across the board, which is going to reduce those interfering behaviors and going to promote those positive and productive interactions that are going to help us moving forward in our parent-child relationships. And next slide. So there's a couple of concepts and a couple of principles, that one that we talked about before, and one that we haven't, that are really important when we're thinking about functional communication. One is reinforcement. We talked before about the importance of reinforcing behaviors, and reinforcing being anything that follows a behavior that makes it more likely to happen. And so often with functional communication training, the reinforcement occurs by the child trying the new strategy and immediately getting access to, or immediately getting the thing that they were needing in that moment. Because that reinforcement, that immediate predictable reinforcement, is what's going to make it more likely that they engage in the new behavior and less likely that they engage in the interfering behavior. And the second principle that's really important to think about when we're teaching new skills in general is an idea that in the behavioral, what we call shaping. And what that is that individuals, when they're learning a new skill, they often can't do the whole thing all at once. And so we at first, instead of reinforcing, waiting until they do everything we'd like them to do before reinforcing that behavior, we want to pick approximations or versions of that. So the example I like to say is, if a child is asking for a cookie, it'd be great if they said, excuse me, I would love to have a cookie. Would that be okay? That'd be a really great way to ask. But that may be, that's light, and that may be a bridge too far for a 3-year-old child. Or instead, if we say cookie or cookie please, that is an approximation of where we'd eventually like them to get. Similarly, if the child doesn't have any vocalization, verbal words, it may not be a word. It may be a card or a picture that we're using to represent what they want. It may be a vocalization at a given moment. So anything that's similar to ultimately what we're trying to teach, we want to reinforce that approximation. And then over time, we can shape that. We can reinforce closer and closer approximations to the goal response, which would be really helpful to be most effective. So over time, that more robust response, that fuller sentence, that multiple step response on an AUC device, if that's ultimately what we like to be, we want to reinforce steps along the way. And so this, a lot of times, as you're getting started, can be really challenging because we often have really high expectations of what we want to see. And it can sometimes feel like it's not exactly what we want, or that we're caving in if we're reinforcing before we're seeing exactly what we'd like to see. But this idea of thinking about teaching and thinking about facilitating often helps me think that I'm trying to help lead a situation into the way where we can have a more functional and a more helpful response than the interfering behaviors that we're currently seeing. And next slide. And so a couple things that we're thinking about with functional communication, we said it before, it was on a slide before, Maddie said it multiple times, behavior is a form of communication. There are many things. And when we talk about behavior, in the world of behaviorism, it isn't just behaviors that are bad or the behaviors that are destructive or behaviors that are interfering. Behavior is in my mind, in the mind of most behavioral scientists, is that behavior are things that we do, things that we say, things that we move, anytime we're walking, those are all behaviors. And those communicate things. And so the more we think about in a given moment, what is my child communicating? What am my child trying to communicate? The more effective we're going to be in thinking about how to help a situation along the way. And so some of you may be familiar with the idea of functional communication and something that could be helpful. Um, and we often hear about it being talked about with in situations where children are non-speaking, that don't verbally speak. We think of immediately about the importance of functional communication in those situations. But this is a principle, and I'm glad Ellen kind of reinforced me on that. I thought that all of us in any situation, you can go back to my last 20 minutes talking about this topic, can communicate ideas more effectively, can be more helpful in situations, especially as they get charged, especially as people are frustrated. If we can help people at those points of frustration think about how to effectively communicate their wants and needs, that's likely going to reduce that frustration, and that's likely going to help with any interfering behaviors that may be happening. So for us as the clinicians, we're often reminding ourselves not to forget about some of these principles that we think about when children have fewer means of communicating. Even as children turn to adolescence and young adults, or old adults, there's always ways to consider how to be effective communicators and how to use effective communication to reduce frustrations. And so if we go on to the next slide, we're going to talk just a little bit about some other teaching skills. Um, through the lens of using teaching skills to help reduce interfering behaviors. So if we go back to my example, a child becoming frustrated because they can't get their coat on. One strategy would be thinking of a way for them to ask for help. A second strategy, which is probably a longer term strategy, the asking for help is probably the immediate strategy. Another strategy is probably more of a long-term strategy, or shorter term, but longer than asking for help, is teaching how to put a jacket on. And so similarly, just as a functional communication strategy could reduce an interfering behavior because it's reducing the frustration in that moment, teaching a new skill can do similarly because it can help the child learn to bypass that situation altogether. So teaching new developmental skills is an important and it's a helpful part of learning to support children in any situation where an interfering behavior is likely. And so in order to reduce these behaviors, we may need to teach alternative behaviors, and we may need to teach some of the behaviors that may be at the source of some of the frustrations. This is often the case with very young children who are really excited to learn something new or do something new, but don't quite have that skill yet. And so we want to talk just about a couple broad teaching skills, just so you're aware of them, and so that you could potentially bring them up with talking with providers or read a little bit more about them in other sources, so you can have some familiarity, and awareness that they're around and that they're there. So if you go on to the next slide. There's a couple of tools that we're going to use for teaching here that we want you to be a little bit familiar with. And those tools are task analysis and behavioral chaining. And again, if you can remember the words, that's awesome. That's really cool. It'll help you when you're Googling them. But the words themselves, the vocabulary itself isn't the whole thing. The concepts are the most important thing. And the idea of a task analysis is that whenever we're teaching a new skill, we want to think about breaking down all of the components and all the little tasks that go into a big task. And this helps us in teaching in general, but especially if a child has any form of developmental delay, because we often think about tasks as a single step. We may think about something about tasks like brushing your teeth and say, oh yeah, you just, you brush your teeth, you just do it. But if you really break it down, there are 10, 15, maybe 20 steps that go into brushing your teeth. They involve, taking the cap off the toothpaste, holding the toothbrush, putting just enough toothpaste on the toothbrush, brushing each side of your teeth. I won't go through each of them, but if you really think about any task and break them down to each part, it allows us to think about the steps of a task and think about what teaching steps may be involved. It helps us as caregivers think about what steps the child's able to do without any problem and where the difficulties arise. And that allows us to think in a more proactive way about how we help teach that new skill. And on some days, we have to start with step one. So for some children, if we go back to the toothbrushing example, we have to start with here's how we hold the toothbrush. Let's practice how we're holding a toothbrush. And then we're going to go on to the next step and so on and so forth. But for some children, we identify that they can do all of it. They just can't get the cap off the toothpaste. And if we just leave the cap loose on the toothpaste, we actually don't have to do any other teaching. And those are great days. You feel like you just accomplished a whole lot. But anyway, this idea of task analysis, that's the technical word, but the idea of breaking skills down into steps and thinking about them along the way is a way to help us think about how we can teach skills and ultimately reduce interfering behaviors. The second, another technical term, is a term called chaining. And chaining is the way we teach a new skill by teaching each step along the way. That's why we do that task analysis when we're doing it technically. We have our task analysis, and now we're going to use chaining to teach the skill in a step-by-step manner. So it's a specific sequence of responses in which the completion of a response is the cue for the next response. Again, all that is just like a technical way of saying that when you start with the first step and you teach one step, and then as you ask the child to practice the one step, and then you as the teacher complete the rest of the steps. And then once the child's completed that first step, that becomes the cue to then do the next step, the second step in the task. And you teach that step by step, 1, 2, 3, 4, 5, 6, 7, 8. You can also do it backwards, where you do all the tasks, then you teach, if there was 10 steps, you can do 1 through 9, and teach the child the 10th step and work your way backward. But it's a systematic way of teaching that allows us to be very specific in the way we help our young children. And again, this is something that you can talk about, task analysis and behavioral chaining. You can talk about with teachers at school. You could talk about with behavior therapists that you may be working with. You may ask about it when you're asking doctors or others where we can find ways to work some of these teaching techniques into our treatment planning. And we can go on to the next slide. Okay, so a couple things to consider with some of our teaching skills. So chaining benefits autistic children by not requiring to learn every step of a task all at once. So that when I first started off by saying, yeah, you just brush your teeth, that asking someone to do everything all at once can be overwhelming, can be too much to kind of process. And this allows us to go one step at a time and make sure we're catching everything that we could. Again, we can teach those steps either way. We can go from beginning to end in the sequence we teach them. We can also do them backwards. So you can teach the last steps toward the beginning, okay? And again, just like I said before, we talked about reinforcement. We talk about reinforcement a lot because reinforcing steps along the way is going to be a really important part to help us continue to increase remember, reinforcement is the increasing the likelihood of a behavior to occur. So that reinforcement is going to make it more and more likely that these behaviors occur once we can start to acquire them. Next slide. And then one more piece of teaching we're going to talk a little bit about, just real briefly, is the idea of prompting. And prompting is something that everyone does and that we all think about. And prompting is providing cues or assistance to encourage the use of a skill or to display a desired behavior. Next slide. So prompts are something that we do naturally over the course of the day. You know, if we're helping a child learn their colors and we have a red crayon and a blue crayon and we say, which one's blue? And you may lean the blue one closer. That's a prompt. We may say, if we're going back to putting the jacket on, all right, time to put your arm through. And we tap their arm. That's a prompt to help the child know that now's the time to put your arm through. It may be a verbal cue. Pick up the big block. That's a cue for what to happen next. And these are tools that we use in the moment to help children use new skills. Again, none of this is necessarily rocket science. It's things that parents are doing every day. But allowing us to think of them not just as things that we do, but as tools for teaching, allow us to think a little bit about how we're doing it, and maybe think a little more proactively about ways to use prompts in ways that may reduce frustration, may reduce some of those interfering behaviors. On to the next slide. So types of prompts, you see me, I mentioned a couple of them. I didn't mention all of them actually as I'm looking at them. I made up all my examples on the fly. We talked about verbal prompts. Pick up the big block is a verbal prompt. We talked about physical prompts. A tap on the shoulder is a physical prompt. Visual prompts are showing a picture of something, you know, a cue of what's supposed to happen now. A stop sign is a visual prompt. Stop, and you stop. It's a visual cue of what's to happen next. And then modeling is when we demonstrate what needs to happen next. So if I'm teaching someone how to swing a baseball bat and they watch me swing the bat first and then have the child imitate what I'm doing, that's modeling, is another form of prompt. So these are different ways that you can use prompts in order to help facilitate learning from a child. Next slide. Okay, so a couple of tips on how to effectively use prompts. We only want to use prompts that are needed. We want to give the child every opportunity to kind of do things on their own, and to kind of, especially in situations, whenever there's always a dance when you're teaching. You know, I think of it sometimes like you're helping someone ride a bike, and you put your hands on their shoulders to make sure they don't fall over, but as they start to ride it, you let your hands off. And you don't, if you're trying to hold on to them while they're riding the bike, you're gonna fall over, you know, and the child's not gonna learn to ride their bike very well, right? But if you don't have your hands there at all, they're gonna fall over and they're gonna hurt themselves. So if we only want to use the prompts that are needed, if the child's already riding their bike and they're going, there's no need to prompt. We want to use several different prompts for each skill. We want to be able to, you know, say verbally arm through while we're touching their arm. We may say pick up the big block while we move the block a little closer. We want to add prompts as they're needed. So I may say, if I was saying pick up the big block, I may first just say pick up the big block. And if the child doesn't respond, I may lean the big block closer, pick up the big block, and I may move it around a little. Now we're adding prompts to help the child recognize what we need to do in the moment. And then the last part, like I said, you're using your hands to support the child. Another really important part is you fade prompts over time. We don't want to walk around, you know, and follow the child around, prompting them to do everything they do over the course of a day. And I doubt the child would be very happy with that either. We only want to think of that dance. We only want to use them when they're needed, and we want to fade them as quickly as we can while still providing enough support so the child is able to use the skill. So the term that we use in the educational world sometimes is scaffolding, just like on the side of a building. We're providing just enough support so that the child can do the skill, that they can acquire the skill. And as they start to master it, we back off and we let them run for themselves. And those are a couple ways that we can think about using prompts. Again, things a lot of you are probably doing already, but we can use them in an intentional way to build skills and reduce some of those interfering behaviors. And on to the next slide. And I think, Sabrina, I don't know if you want me to keep on with this one, or if this is where maybe Kevin may be taking over.
Yep, Chaz, this is where I can take
All
over.
right, I'm going to hand it over to Kevin now.
And so the techniques and principles that Chaz has been sharing are really important for us to know, and it's part of structured and standardized resources and treatments and therapies. But there are barriers to care. Some of you might have experienced these where you suspect that there might be these good things out there, but how do we get access to them? That's another question. There's several things that can go into this problem for these barriers. There could be really complex treatment protocols where brilliant researchers come up with these wonderful programs that work really well. They do research studies where they systematically test this highly structured program where people are trained to fidelity on it and are really good at doing it. But then there's this gap between what research shows is really helpful in these academic medical centers, but then finding these wonderful therapies in everyday settings doesn't always make it there. Another potential barrier to care could be stigma within society of children with developmental delays, autistic children with unique needs in different areas. So stigma might lead some to not seek out care or otherwise find a hard time getting that access to care. And then this third one is a lack of specialists that are trained in the techniques like we've been talking about today. There could be a shortage of those specialists, and particularly in certain areas of the country, under-resourced areas, rural areas is oftentimes where we lack people with that specialized good training. Next slide. And so how do we confront this? And we know we need different solutions. What kind of our usual process for doing these research studies, coming up with these interventions? We know it doesn't work. They work, but not to the degree that we really want them to. And so there are several potential solutions to these barriers. One is simplifying the treatments. Can we focus on a functional communication strategy and really just narrow down what our focus is to make it more accessible for families? Can we use digital technology to improve access? Maddie's going to talk through next different things that are coming up now, but technology seems to be this really great way to leverage information and get it out to people. And then a third way that we're doing as part of this Echo series is to share the work, to task share with other people. So it's not just the highly trained providers, psychologists, psychiatrists, or other medical providers that are the only ones that can provide this work, but can you all share information that you have with others? Can social workers, integrated primary care providers, nurses? Are there other people that can be trained to know these solutions and find ways to share them with others? And so that's the idea of we need to change our process. We need to adapt and be flexible. And the Echo series is one way that we are doing that. Next slide.
Thank you, Kevin. So talking about technology in terms of what we talked about today, how can we help autistics be able to communicate effectively in the surroundings? And there's a lot of technology tools that are available that can do that. And I'm just going to talk about a few of them that some experiences that we've had in our family. My oldest son has a lot of challenges with direct communication. You ask him a question, he may not answer it right away. He'll come to you and he'll talk, but having two-way conversations is challenging. One of the things that we found is that if I asked him just as a joke one time through our Google Home device, I was upstairs and he was downstairs in the living room. I asked him, "Yeah, Ashley, can you do this for me?" And he heard the beep and the Google Home saying, asking the question, and he responded so the communication, the two-way communication was able to be done through technology. And we realized it's because when autistics like using tablets and like using Siri and Google and Alexa, it's because there's a natural order to the communication style. And so using that is real, can be really effective. We use it in terms of helping manage our appointments, manage if we have only like 1 hour to do something, we can put a timer on the Google device. We can put something on the screen that they can visually see a countdown to. And these things allow them to have an expectation of what's happening next. And when the Google says, okay, time's up, it's not a parent doing it. And there's a bit of a difference in how they relate. So there's depending on the age, the way kids will use technology will be different. But I find as my kids have grown, we've seen this growth they've had in being able to communicate, learning that style online, then finding a way to replicate that in the real world. Well, the real world, it's still a real world, but in the physical world. I've just seen so many families being able to actually find a way to communicate that's different, but then can be generalized into the physical world. All right, next slide, and back to whoever's next.
I think that's me. All right. So today we talked about a lot of things. Thank you so much, Chaz and Kevin and Maddie, for all of the information. What we want you to all be able to do is put this information into your learning. So you've done a great job of learning today. Now we want you to share this information with your treatment team, with family members, with other community partners, and communicate with your team that interest if you want to learn more about parent training or about these foundations for building positive behavior. Next slide. As we said at the very beginning, you are significant partners in care. So just remember, behavior is communication. So collecting data on behaviors and sharing it with your clinical team is really helpful for everyone. Participate in parent training and therapy sessions, and learn skills to promote positive behaviors. Build the capacity of your child through strategies that we talked about today. And as I said before, share this information and best approaches with others, especially what you know is best for your own child. So you can definitely tell, even if they're the professionals, you can say, what I've learned with what works best for my child is this. And keep the lines of communication open by sharing this information with everyone that you work with. Make sure you're giving providers permission to speak with one another to coordinate care for your child. Next slide. Janelle, are you going to talk about any of these resources, or do you want me to?
You're welcome to talk about the first two, and then I can address the last two if you'd like.
Perfect. A couple of resources. The RUBI network is what we have been kind of basing some of this information on. And then Attend Behavior is an app that follows the RUBI program that you can look into.
And our Challenging Behaviors Toolkit. So it's essentially a long booklet that kind of talks even more about some of these strategies that they've mentioned. And actually recently we released something that's called a roadmap. So it's a little bit more manageable and easier to read if that large amount of information is overwhelming. So I just put a link to that in the chat. That's typically a good place to start. And then if you want more, you could go to the toolkit. But just in general, if you have questions about what you've learned today, if you need help finding therapy providers or anything else, please feel free to reach out to us. We are available via phone, email, and chat on our website in English and in Spanish. And we'd be happy to talk to you more.
Thank you, Janelle. You can go to the next slide. Just some additional resources for you all. As we said before, you will be receiving all of this information. You'll get the slides will get sent out with all of the resources as well. Next slide.